Assalamu alaikum. In this video, I will talk about suicide ideation. So, to think for suicide, like you will just think and you will want to implement, but you would not because you are just like in the stage at which you are thinking about the certain things and the certain issues and want to suicide. So, what is suicidal ideations? Like suicidal thoughts or suicide ideations refers to thinking about or planning suicide. Thoughts can range from creating a detailed plan to have a fleeting considerations. It does not include the final act of suicide. So, as I told you before, it does not contain include the final act of suicide. So, who experiences suicidal ideations? Like those who are mentally ill, like they are mentally ill. So this is the major contributor who are mentally unstable. Like they do not have proper mental health. So those are the one who think of suicide. So the second one are like common among those experiencing profound depression, who are the target or the victim for depression, have like thinking they every day they think about suicide. So suffering from a psychotic disorder, and those who are like having any psychological or psychotic disorder, they also want to end that pain, and they think for suicide. And preceded feelings of extreme sadness, helplessness, and loss of hope. These are the persons like those who are extreme sad and like helpless, and lose all the hope, and they also think about suicidal ideation. So here's we should never forget that ups and downs are the part of our life, and we should face all these difficulties and problems by being strong, positive, and optimistic. So here are some factors: treatment and preventions of suicide ideation. Factors influencing suicide ideations are as following. Like previous suicide attempts, अगर उस बंदे ने पहले से कोई सुसाइड अटैम्प्ट की हुई है तो उसको ऑटोमेटिकली बार बार दोबारा से सुसाइड के लिए वो जाएगा उसकी तरफ, क्योंकि वो एक कहते हैं ना रास्ता फरार, उसकी तरफ हो जाएगा। तो वो प्रीवियस सुसाइड अटैम्प्ट एक उसके अंदर फैक्टर है कि वो नेक्स्ट सुसाइडल आइडिएशन की तरफ लेकर जाए उसे। एंड द नेक्स्ट वन इज़ मेंटल इलनेस सच एज डिप्रेशन। अगर वो डिप्रेस्ड है बंदा, तो वो जैसे मैंने आपको पहले बताया कि वो उसके लिए भी एक है कि वो सुसाइड के बारे में सोचेगा। एंड सोशल आइसोलेशन में सोशली वो आइसोलेट कर जाता है फैमिली से, अपने फ्रेंड्स से। उसके बाद हर उसे गैदरिंग पसंद नहीं होती, सो वो ऑटोमेटिकली किस तरफ जाएंगे, वो सुसाइडल आइडिएशन की तरफ जाएंगे। एंड अदर क्रिमिनल प्रॉब्लम्स लाइक थेफ्ट, रॉबरी एक्सेट्रा, एंड फाइनेंशियल प्रॉब्लम्स के कोई जॉब वगैरह का इशू हो या फिर पे कम है, ये सारी चीज़ें भी इंसान को सुसाइडल आइडिएशन की तरफ लेकर जाती हैं। एंड सम सीरियस इलनेस, कोई डिसऑर्डर आपको हो गया है, अगर कोई साइकोलॉजिकल है या फिजियोलॉजिकल है, कोई भी हो दोनों में से, तो दोनों हमारे लिए सुसाइडल आइडिएशन का एक फैक्टर बनती हैं। And substance use disorder like alcohols and other mediums, we can say. So these all are the factors which influence suicidal ideation. We will talk about some of them. Mental health. In many cases, thoughts of suicide are caused by underlying mental health disorders such as depression, schizophrenia, and or bipolar disorders. It is a personality disorder basically. So mental health issues also relate to suicidal ideations, and medications. The use of certain prescription drugs, including antidepressants and sleeping pills to relieve pain, may also increase the risk of suicide. Medications भी बहुत दफ़ा ऐसा होता है कि आपको सुसाइड की तरफ ले जाती हैं। और substance use, misusing alcohol or drugs often contribute to suicidal thoughts and behaviors. Loss or fear of loss, like a person may decide to take their own life when facing a loss or a fear of loss, like fear of loss, losing a person basically here. So hopelessness is long lasting trait and has been found in many studies. The person may be facing a social or physical challenge and may see no way in which the situation can improve. He is totally hopeless and he don't want to get any hope in any situation, or he don't want to get any sympathy from anyone. So this is one of the cause for suicidal ideation. Then social isolation, as I've told you before, like socially isolate हो जाना फ्रेंड से, फैमिली से, लाइक किसी भी और किसी रीज़न की वजह से, लाइक डिवोर्स हो जाना, लाइक फिजिकल या मेंटल इलनेस आपको हो गई है तो उसकी वजह से भी आप आइसोलेट कर जाते हो, तो ये सोशल आइसोलेशन में आएगा. So here's some treatment for those who are suffering from suicidal ideation. So it's a talk therapy. It is also known as psychotherapy, and CBT is a form of talk therapy that often used for people who are having thoughts of suicide. CBT can also help you replace negative beliefs with the positive ones, regain a sense of satisfaction and controlling your life. So DBT may also be used, like we can also use DBT. CBT is basically a simple talk therapy. The psychologist talk to the person who is having those thoughts and change those negative thoughts to the positive ones. Medication. Here are some medications. If talk therapy is not working, is not enough to successful, low risks. लाइक देखो, अगर टॉक थेरेपी हमारे उस पेशेंट के लिए इतनी नहीं है हेल्पफुल या सक्सेसफुल नहीं है, तो हम ये बात करेंगे कि हम मेडिकेशन देंगे उस पेशेंट को. तो मेडिकेशन में क्या है कि या तो एंटी डिप्रेसेंट्स होंगे, या फिर एंटी साइकोटिक मेडिकेशंस होंगे, या फिर एंटी एंजाइटी मेडिकेशंस यूज़ करेंगे. लाइफस्टाइल चेंजेस क्या है, लाइक अगर हम बात करें कि हम लोग और किस तरह इस चीज़ को ख़त्म कर सकते हैं, एज वी आर टॉकिंग अबाउट ट्रीटमेंट, तो हम अपना लाइफस्टाइल चेंज करके भी इनको ख़त्म कर सकते हैं. जैसे कि हम कह सकते हैं सुसाइड रिस्क कैन समटाइम्स बी रिड्यूस बाय सिंपली अडॉप्टिंग सर्टन हेल्दी हैबिट्स. अगर हम हेल्दी हैबिट्स को लें, जैसे मैंने पिछली वीडियो में आपको बताया कि हेल्दी और हेल्दी हैबिट्स किस तरह की होती हैं, तो अगर हम यहाँ पे बात करें तो अवॉइडिंग अल्कोहल एंड ड्रग्स, तो ये एक बैड हैबिट है. अल्कोहल और ड्रग्स को लेना, एक्सेसिव ड्रग्स या ड्रिंक लेना, तो ये हम लोग इसको चेंज करें पॉजिटिव में. और इसको किस तरह कर सकते हैं, अवॉइड करके. सो स्टे अवे फ्रॉम अल्कोहल्स एंड ड्रग्स, like exercise regularly, exercising at least 3 times per week, and sleeping well is another thing. It's also important to get enough quality sleep. Poor sleep can make many mental health symptoms much worse. So here are some ways. Now, how to prevent suicidal thoughts we will talk about, like even the darkest night will end and the sun will rise. Definitely everyone believes in it. So you can prevent suicide ideations, like to talk to someone. If you're having some thoughts like you're not up to, like you're getting hopeless, and in many situations you just lose hope and like you don't feel good, so talk to someone. You should never try to manage suicidal feelings entirely on your own. Getting professional help and support from loved ones can make it easier to overcome any challenges that are causing these feelings. So the National Suicide Prevention Lifeline is a great resource here. So here another prevention, like never skip an appointment. It's important to keep all your therapy sessions and other appointments. Sticking with your treatment plan is the best way to deal with the suicidal thoughts and behaviors. Thank you for listening. Subscribe the channel and share it. Thank you.